Now, traditionally, we know that from the time immemorial, we have always had the same expectation from the healthcare delivery mechanisms. That is, the healthcare delivery will be of high quality and that it will be accessible to everybody and at a affordable cost or a reduced cost than what we have now. If we looked at what are the different elements of the entire ecosystem, we have preventive health, we have prescriptive health, which is what happens inside a healthcare delivery system, which is in a, let's say, a hospital, a clinician, small hospital, big hospital, secondary care center, tertiary care center, and population health, which is that of the community. And all of them together form the entire ecosystem. Now, I just want you to look at the complexity of the healthcare system, the multiple processes that a patient has to undergo, or I would say even a citizen has to undergo, because preventive health also is part of this. So you have the patient demographics, you have the patient's records for the labs, for the diagnostics. We have all the ancillary healthcare systems that the patient can sometimes be actually taking service from. We have the records of what happens in the hospital. We have patient care at home, and we have patient care demographics being compiled for the purposes of the policymakers and larger comparative studies. In addition, we also have research, which is, which can happen in any of these areas. So this is the entire complexity of the healthcare system. Now, if we looked at this, do you think that it is possible to manually integrate entire thing and try to arrive at decisions? Because which is what we have been doing for so long, and that is the reason why we have not been able to deliver the best healthcare service that we can actually give. So in order to really service this entire system, you need something which can collaborate all the data, collate all this data, actually put it all in one place. And that's the need for digitization. So in this complex environment, what we need to do is change and look at everything that the patient undergoes during his clinical care. So what is the requirement? The requirement is that the care has to be patient-centric, which brings us to, giving a unique patient ID and having a single longitudinal record of a patient from birth to death. So literally a cradle to grave documentation, a patient portal which will empower the patient with the data in his or her own hand, and the longitudinal record, therefore, enabling continuity of care. It needs to be led by the clinicians, based on good controlled workflows, clinical pathways, computerized order entries, and various protocol-based documentations. It needs to be guided by evidence-based medicine, should have best practices incorporated in it, and must also integrate the applications like billing, purchase, costing, and should be focused on transformation, which means transformation towards better care than what we are delivering today. So there is an ideal towards which we have to move, and that has to be a step-by-step movement by a transformative process. Which means that for this we required an agent to bring about this change, and that agent is digitization. So what we need to do is integrate all these healthcare delivery systems, which I just discussed with you, ensure that every aspect can be touched, and it is inclusive of every stakeholder. Now, stakeholder could be a physician, could be a doctor, could be a nurse, a technician in the hospital environment, could be a public health person, a public health employee, the ASHA workers who come home, could be vendors, could be developers of technology, developers of equipment. So all of them need to be integrated. Their service deliveries need to be integrated to provide the best possible care to the patient. Now, we must have all, I'm sure, heard of the Ayushman Bharat Digital Health Mission, which has been rolled out by the PM a few days ago. Last year, in 2020, actually on the Independence Day, the Prime Minister had rolled out the National Digital Health Mission, which now has been rechristened into Ayushman Bharat Digital Health Mission. If you ask me, I think this is the single most important game changer in the country. In 21st century India, if something has, really going to catapult the way the healthcare services are going to be looked at, it is this policy. It empowers the citizen. It is citizen-centric, patient-centric. Patient is at the center of this entire policy, and that's how the Digital Health Mission is going to be rolled out and worked. It's going to change the way Indian healthcare system is, and it is definitely going to change the way we can project ourselves to the world, and probably is one of the most, I would say, the daring initiative a government could have taken, because the magnitude of this initiative is humongous. As I just mentioned, here there are two most important things about the Digital Health Mission. One, it is entirely focused on empowering the patient. There is a unique health ID that is being given to every patient, which you could look at it as similar to Aadhaar card. So we all have an Aadhaar ID number. So this unique health ID, it is a voluntary thing. It is not mandatory for every citizen to take this, but the benefits are so huge that I'm sure all of us would want to take a unique health ID. This, along with the fact that it gives the control of the patient's own data in their own hand. So that's the crucial aspect of how data is so important for every decision making in healthcare throughout our lives is being respected here. And just these two important focus areas is changing the entire dimension. So as I mentioned, so you have unique patient IDs. There are standardized health registries, whether it be for the human resource like the doctors, the nurses, the technicians, or the other ancillary healthcare providers. There are registries for the types of hospitals. We discussed a little bit about the health records. So patients' records, every event that happens in a patient's life, whether it is right from birth, from immunization onwards to every preventive or curative intervention that happens in the patient's life is recorded. It also integrates all the payment settlements, and therefore, you have all the insurance schemes. So the idea is to reduce the cost of healthcare. The idea is also to make sure that all these payments and the records are transparent. So that's very, very important. So what are the imperative changes that we expect will happen once the National Digital Health Mission is rolled out? We will have a cultural transformation of the traditional healthcare. So we will have to reorient our outlook in the way we seek and deliver healthcare. We no longer have to run to the hospitals, to the physicians. A lot of it will be done online. A lot of devices will come which will, preclude the need for us to go for a physical visit of the hospital or to meet the doctor. The open data paradigms, sharing across multiple stakeholders, but controlled by the patient. Not controlled by the hospital, not controlled by the physician, not controlled by the government. It will be controlled by the patient. So if I'm the patient, I have the control of my data, not government, nobody else. And the hospitals, the healthcare providers, the government, they don't control. They need to be sharing the data with each other. So that is for the best outcome for the patient. Now, traditionally, we have been, in the prescriptive health, if I was to just give you an analogy, what happens when a doctor sees a patient? I see a patient, I examine a patient, I have taken history, examined, so I have a set of data, which is in my mind. I do a quick analysis of what all these combinations could be. I do the permutation combinations of those sets of data that I have gathered, and based on whatever I've studied and the similar patients that I've seen, and I generate a prescription. So this is the general way of how it happens. But compare the capacity of a single human being's mind. Now, obviously, it is not possible for a single individual to remember so much data and to have seen so many patients to give the best possible diagnosis and the best possible treatment. So how does digitization help? You have a repository of data that is analyzed by the systems. And that can then, so the experience of one physician is multiplied manyfold to give us better and better results at what we are doing. So you have various data sources. You have the electronic medical records, you have the hospital information system, you have different equipments that is generating data, and that is also, interface with the EMRs. There are multiple devices, IoTs that are gathering data, apps which we are, logging on to, gathering data, and they're all put in one place. In a structured manner, this data is captured and analyzed. And based on the algorithms of AI, we can then focus on either predicting care for a particular cohort of people or that type of person with that symptomatology and that combination. We can give personalized care with genomics added to it. And we can ensure a continuum of care because we have longitudinal data available with us. So this is the power of the amount of information that we have in a digital age. So look at the amount of data that we get and from the sources that we get. It is impossible to have, we could not have imagined this happening, let's say 10 years ago. We had, an idea that if we could do this, this would be the best thing to do or the best way to go. But the initiative that the government has taken now to digitize, this is a reality. This is going to stay with us. And we all have no choice but to follow this. So how else do we approach healthcare now? We need to change our orientation from just purely disease focus to wellness focus. And why? Because now we are looking at a patient from birth to death as an entity. We need to look at a population focus rather than a single patient alone, because patient is part of a larger community and the entire community's health is important from our human capital perspective. So we are looking at how the human capital of the country is going to be managed. We need to look at service-based to a value-based approach. We pay based on the outcomes that we get and not on the kind of service that we do. We need to look at not at episodes of hospital admission, single episode, myocardial infarction, patient came home, patient got discharged and forgot about it. No, we have to look at, as I said before, from birth to death, continuity of care. Today a person has myocardial infarction. A year later, he has a stroke. 5 years ago, he was diagnosed with diabetes. All these are related. The fact that he had diabetes 5 years ago is something that made him prone to the cardiac event, to the neurological event. So similar, there are correlative events, there are non-correlative episodes, but all of that needs to be part of the care continuum of the patient, so that wherever the patient is being seen by whichever doctor on a particular date, that person's entire case history is available and the patient can give access to the doctor to see, and doctor can see the whole history at the back. We right now have this one size fits all kind of an approach, saying we have a standard treatment for a particular ailment, and irrespective of who the patient is, by and large, we give similar treatment. But what will happen when we have so much of data on individual patients is that we will be able to customize care to a particular patient, because although each one is similar in many aspects, we are all different individuals. So that difference can be used to customize the patient and personalize the medicine that we give. And at this moment, if we see, our entire healthcare approach is reactive. That is, a person falls ill, and we give treatment. Whereas what will happen when we have a focus on wellness, we can then give predictive and proactive care so that the person remains well rather than waiting for the patient to fall ill and then treat. So a large focus in future is going to be on wellness and ensuring that the patient does not have to go to the hospital. That's the focus area that's going to be. And that's our approach. At the end of the day, what do we all want? We all want to remain well. It's not that we want to fall ill and get treated. We want to remain well. And that's the purpose of, and that's the focus of this entire exercise as well. We need to move from doctor-centric to patient-centric. And as days go by, with so much of online consultation and so much of permeation of digitization and reaching to the, every nook and corner of the country, or in fact the globe, the care will be home-based. It will be where the patient is rather than where the infrastructure has been created. So what will happen is, today, if we want to consult a doctor, we have to go to the hospital. Here, consultation is going to be done sitting in your home, sitting in your office, sitting in your lounge at the airport or a railway station, sitting where you are, so that the healthcare is literally at the doorstep, or actually literally where you are at a particular point. And of course, this requires, the care requires collaborative decision making, and therefore so much of data input will be required. And doctors will no longer be just, a local hero, because initially, as when we were kids, it was all about the single doctor, and whatever the doctor said, it was the gospel, and care actually ended there. But now doctor is one part of the team, and the central part of the team is actually the patient now. What are the challenges in this environment? One is, of course, we can have unreliable online sources. It requires a lot of work to be done to make sure that this, the reliability factor increases. There can be misinterpreted information, security breaches, and of course, online medical quackery that can also be, a problem. But for all these things, the group of stakeholders and the healthcare community needs to work together to ensure that this is minimized. Another major challenge that we always thought would be a slow adoption by healthcare workforce. It still remains a challenge. One factor is that the doctors or the healthcare, the currently traditional healthcare delivery environment, which is a hospital or a doctor, is afraid to lose control. They feel that, that they will be controlled by the onslaught of so much of data being at a third-party space. Well, the COVID pandemic has to a certain extent reduced this fear, and the adoption by the people, the doctors and the patients alike, because of the fear of getting COVID, actually has been sort of responsible for reducing this fear to some extent. There is another fear that people have, is that this may dehumanize care. And when I say dehumanization of care, what I mean is that whole touch and feel thing. That you feel that unless you have been felt and probed by the doctor, you don't feel that somebody has seen you properly. And teleconsultation is just a call, and how much can a person talk and get this, get information by just calling. What I want to, emphasize here is that there is a lot of technology development that is happening, where different kinds of sensors are being developed, different kinds of IoTs are being developed, where you find that you don't have to be sitting in front of the doctor for the doctor to use a stethoscope on your chest. You have digital stethoscope which you can use in your home, and the doctor can hear you miles away sitting in some other part of the world through a digital stethoscope. Similarly, a lot of such devices, the digital ultrasounds that are happening, all of that is going to reduce this factor of dehumanization. These devices will pick up same information or even better information that a doctor can pick up with the touch and feel at this moment. So this is going to augment what the doctor can otherwise do. So this is something that we should now not be afraid of anymore. So the patient of the future, I call this patient the e-patient, which is an engaged patient, an empowered patient, and an equal patient. And why are they so engaged and empowered? Because they have a lot of information that all of us have. I mean, in this day and age, the amount of information that any patient has is enormous. It's just that it needs to be channelized a bit, and that is where the discussion with counselors, the doctors, and the healthcare providers comes handy, whereas the misinformation part is removed and the patient gets the right information. And then the patient is a participant in decision making, as an empowered participant in decision making. It's no longer doctor ne bol diya, so it is correct. Whatever the doctor says, I'm ready to believe. It's no longer that system. The patient needs to know what is happening. And how is the digital age doctor? Tech-enabled doctor, team player, collaborator, and a guide to the system, and a guide to the patient. And allowing inclusive decision making at every step, whether it be with the patient, whether it be the family of the patient, or any other caregiver in the system, the whole circle of care of the patient. So what is the impact of this digital landscape on the care providing system? We have seen in the last 2 years that the care delivery systems and models are changing rapidly. We have newer type of job categories available for the workforce. We are looking at ensuring that there is less burnout and there is more sharing of work. There are much more opportunities for big data use and for the value-based payment models. And this is changing the way the healthcare delivery is happening today. And these models, whether it is the business model or the financial model, this is going to change furthermore rapidly till such time that it arrives at an equilibrium. So right now it is just trying to find a place. On the consumer, what is the impact? On consumer, the focus on well-being, the focus on preventing the consumer from getting ill is going to be paramount. Participative decision making, everything being discussed openly, patient being an equal stakeholder in the decisions, provision or at least an ability to purchase personalized medicine and to be part of a connected care system. That's the advantage to a customer. And what about the technology developers or the equipment manufacturers, which are also the stakeholders in the system, is that they need to now make sure that whatever technology they develop, whatever device or equipment they develop is empowered with or is equipped with mechanism to capture data accurately, mechanism to have a seamless exchange of data through interoperability, and ensure compliance to the ever-evolving guidelines which are being given by the government, which may be right now in the digital health space. There are telemedicine guidelines, there's data protection bill, there are many other guidelines that are in the pipeline and it's being developed. So a lot of such changes will happen, and we need to make sure that we are always abreast of what is happening here and be ready to adapt and change. Because if we don't adapt, we'll not be able to move forward. There is a significant impact on cost reduction. In my first slide, I showed you that we are always looking at how to get care at an optimum price. So when we reduce travel, we reduce duplicity of data. No longer a patient has been, right now what happens? a patient has some lab investigation scans, the reports are not available or they are not very easily readable. We are not sure where the tests have been done, and we repeat all this. Now, once it is digitized, the whole ecosystem is connected. I can see what was the test which was done last week in, let's say, Bihar, and the patient comes to Delhi. I don't need to repeat the test. So the cost, immediately cost to the patient has come down. Now, many of those test reports, we can actually have online consult with the doctor. No need for the patient to travel. So there is again a reduction of cost. Promotion of wellness, which means reduce events which require hospitalization, reduction of cost of care. Customized care, more focus, therefore elimination of waste because of generalized standard, of care. So that generalization of care where you end up shooting in the dark, that is avoided, and we are going to be more precision based care, which reduces and eliminates all the waste and therefore reduces the cost. And predictive analytics, which actually helps us to make the patient healthy or keep the patient healthy, I should say. So in a nutshell, if I was to say what is it that we can expect this digitization to achieve in healthcare, is it will achieve the entire clinical and business landscape transformation. It will actually improve the quality. I have already told you how it does that. It will reduce the cost. It will reach anywhere and everywhere patient in every nook and corner of the world by actually analyzing structured data that has been captured, that is automated, and therefore this entire transformation can be achieved. So if I was to summarize, the digital health mission, or the Ayushman Bharat digital health mission, is going to force us to make unprecedented changes in the products and delivery models of healthcare. And in this new environment, if we don't adapt ourselves quick enough, if we don't learn what we need to do, and if we don't stay abreast with the very rapidly changing guidelines and the policies, we may not be able to thrive. So in order that a healthcare stakeholder can thrive, we need to make sure that we adapt very quickly to the new environment. Thank you so much.